And a new study suggests doctors should always measure blood pressure in both arms, not just one. And if they don't, they could be missing significant signs of heart disease. Dr. Bobby Mukkamala is here this morning to weigh in on this new study. Good morning.
Good morning.
Good morning. So what they're saying is different blood pressure readings in two different arms will give you different information.
Yep, and it kind of makes sense when you think about it. I mean, all the branches, all the big arteries come off the heart, and then some go this way into this arm, and some go this way into this arm. And if there's narrowing along one of them, and you're checking the arm that's not affected by that narrowing, it'll come out normal. Then you check it over here in this arm, and because that blood is flowing through a tighter spot, it raises the blood pressure. So it kind of, you know, when you look at it, it's one of those things like, oh yeah, that makes sense, duh.
Does a study like this, you know, I guess, will doctors start doing them in both arms?
Right. So that's the researcher's main question also, is that it did show that there was, like, 2.5 times the risk of peripheral artery disease and even a 60% increased risk of stroke. So so it makes sense that if the blood pressures are different, then yeah, you're going to treat these patients differently, you're going to treat them more aggressively for these conditions. And so they were wondering whether or not people will actually incorporate that into their practice, because it's kind of been a guideline all along that you should check it in both arms for this reason, but it's kind of been a guideline that's been on the shelf and never really in practice. And now the question is, with this sort of compelling evidence, is it something that everybody's going to do? Switch the cuff over here, measure it, and then write down both blood pressures.
So do you think this one person could have high blood pressure in one arm and it'd be fine in the other arm?
Absolutely.
Really?
Yeah, yeah. I mean, because they're talking about a difference of about 15 millimeters of mercury systolic blood pressure. So you could be 120 over 80 over here, and then 135 over 85 over here. And that's enough of a difference that it increases your risk of these conditions.
So maybe if your doctor's not doing it in your office that you go to, maybe you can suggest, hey, can you take it on this side too?
Exactly, right. Especially if you're at high risk. If you have some high blood pressure issues, cholesterol issues, a family history of this sort of condition, those are exactly the type of people that really should say, hey, I'm curious, would you mind doing it over here too? And then make sure that they write it down so they can trend it over time. Because a lot of times in charts, there's one spot for blood pressure, especially now that it's electronic. You're going to have to find two spots to put, one in each arm and then label it left and right. So it's going to require a little change.
So real quick, those machines you go to at the pharmacy, they're going to make them double-fisted now? Or double-armed?
That's true, actually.
What do you think?
Because they're kind of just made for the one arm.
Right, they're made for that one arm.
Yeah, and you can't. It's going to be hard. There's no seat on this side of that thing to stick your other arm in.
You have to go backwards, and do it this way.
I think we should patent the double-arm blood pressure measure.
The double-arm blood pressure machine. I love it. Dr. Bobby, thank you as always.
You're welcome. You're welcome.